Now, the Ebola virus is certainly putting authorities in Liberia on their toes. In order to contain the rate which the virus spreads, Liberia has suspended all football activities. A football association said there was a risk of infection because football is a contact sport. And sadly, the World Health Organization has confirmed that the number of people killed by the virus in West Africa has now reached 672. Ebola kills up to 90% of those infected, but patients have a better chance of survival if they receive early treatment. It spreads through contact with an infected person's bodily fluids, and this is the deadliest outbreak of the disease since it was reported back in the 70s. It spread to Liberia and also Sierra Leone, with just one case now in Nigeria, one case reported previously also in Ghana. I have with me now our health correspondent here on Channels Television, Yomi Otaibe, to talk more about Ebola. So people are really scared, of course, here in Lagos, understandably so. One person, and then the fear is, how many people was he in contact with?
Okay, it's nice to be here, first of all. And yesterday there was a briefing by the Joint Health Sector, the Lagos State Ministry of Health, the Federal Ministry of Health, and other international partners. And indeed, 59 people have been identified and registered. Of course, this includes the nurses that attended to him at the airport, 3 ECOWAS members of staff, the driver, the liaison officer, the protocol officer, and a few other people. Now, what we need to clarify is that yesterday, at the briefing, it said Nigeria's ambassador to Liberia, Ambassador Chijoke Obi Nadozie, yes, that she was on that flight, but indeed it has been clarified now by the Federal Ministry of Health that she was not on that flight. Indeed, it was the ECOWAS president, representative of the ECOWAS president in Liberia, Ambassador Babatunde Ajishomo, that was on that flight.
So what you're indirectly saying is all those on the flight with Mrs. Sawyer, all the way from Liberia, have been quarantined?
And those that were on ground.
Those were on ground.
Those in the hospitals, they've been, identified, registered, and they are being monitored now to see, okay, between 2 and 21 days to see if they're going to come down with any symptom. But it's very important to point out that the Federal Ministry of Health, the Lagos State Ministry of Health, and every other partner involved in this need to bring out every information that is coordinated. Because now I hear that Ambassador Nadozie, she's already been queried in Liberia, and the government wants to take her in and all of that. So this misinformation should actually be checked.
But would it be wise to take in people who are suspected of being, in the line of fire, probably those who might have had contact with the man himself? Because what I heard was that Mr. Sawyer was at the Nigerian embassy in Liberia. Okay,
well, on the Liberian part, we'll have to wait to see what they are going to do. But right here in Nigeria, the contacts, according to the director of Nigerian Center for Disease Control, Professor Abdulsalami Nasidi, will come in 4 types. First, the people that had casual contact with him. Secondly, those in the hospital that had contact with his blood and other bodily fluids. And then, like those that work in the mortuary that had contact with the dead body.
Yeah.
And more importantly, those that had contact with all of this group of people that have had contact with the late Mr. Patrick Sawyer.
So the list just gets longer. But okay, for the benefit of our viewers, a lot of people are wondering, okay, so now that, is it safe?
There's been a lot of panic everywhere.
Exactly. Is it safe to say there's no Ebola in Nigeria?
As at now, and from what the joint team said, there's no case reported aside from Mr. Sawyer's case.
Okay, so let's just talk about preventive measures very quickly before you go, because people are afraid of shaking hands now. People are afraid to hug people, understandably so. What really should people really know? What are the basics to know basically about?
Okay, as we said, talking about the mode of transmission, we've talked about body fluids, which has to do with the urine, the blood, the sweat, saliva, and perhaps if the person has really become very sick and is vomiting. So all of those kind of body fluid, we should avoid them, especially if you see somebody that is very sick. Be careful to touch such person. Instead, there has been, a number of telephone numbers that we can call. And then the symptoms will start. We've talked about fever. It is not just fever. It has to be a fever, for instance, that somebody has treated and is unresolved.
Okay.
It is persistent.
Persistent fever.
Headache, and in the late stages you have bleeding. And the bleeding does not necessarily have to be like you're seeing the blood. Like the eyes can be very, like bloodshot.
Okay.
Like you can see patches of blood on the person's body. So we want to look out for such things. And if you see this, report to the nearest hospital or call the numbers.
Okay, talking about those numbers, which will, of course, be showing up on our screens in just a few minutes. If you do notice that someone has persistent fever and all of the symptoms that you have mentioned at home, you call the numbers. What's Lagos State Ministry of Health to do? Will they come pick up the person?
Yes,
okay.
Yes, because these teams have been divided. Those that would monitor, like all of those people that have contacted Mr. Sawyer, and those that will go all out to look for the people that call, that say, okay, I have, or I suspect that this person may have this disease, and then the Lagos State Ministry of Health and its partners will move in.
And those are the numbers that you have on the screen.
Yes.
I'll just read out the first one, though, 080-231-69485. Those are the Ebola control numbers. They're all listed on your screen. To do well to note those numbers.
To note them down and just
course,
save them.
Yes, and of course, the key point here is if you do notice someone with these symptoms, don't treat them yourself.
Yes, we shouldn't go paranoid, though.
Exactly. Though.
That, okay, I don't want to shake Amara because I could contact it.
Thank you so much, Yomi.
Thank you.
Our health correspondent, Yomi Otagbe, here in the Channels Television.